So I heard a certain code and I didn't know what it was. And I'm just sitting up there and I didn't have to respond to it. And then I heard it again a second time. So let's just go down the ER and see what it is. And I turn the corner and there's a pregnant lady that they're doing CPR on.
This is gonna hurt. It's time for the Suffering Podcast.
Gratification. You see something, you fix it. As opposed to, medical doctors have to think about it and see what happens over a couple of weeks. We want to take care of it right away. So
there's no take these and call me in the morning.
No.
Take two and call me in the morning.
Yeah.
Exactly.
Now, did being in EMT and a medic bring you into the trauma field? Like all the accidents you saw? And
I knew I was going to eventually go into that, and I was itching, so that's what I did in the meantime. But I think it made me a better doctor seeing the EMS side of it and the pre-hospital side and what you guys go through on the field. That helped me a lot because a lot of doctors never see that.
But there's also an adrenaline rush to it. Now, I know certain things that I've been told by your friend who's sitting in our booth out there.
Yeah.
You have some adrenaline rush things going on. Is that sort of the draw to trauma?
I think it attracts the same type of personality. It's like you said, they run into the fire rather than run away from it. And, that's why since about 2003, 2004, I've always been involved in the law enforcement aspect of trauma and critical care and stuff like that. So I kind of do both things.
So I know you're tied into the law enforcement community, which is kind of one of our connections here. You do a lot of things for law enforcement. What is so attractive about the law enforcement side of your field?
I like to help people who are helping the world, helping society. You guys are keeping us safe. My kids are sleeping tight because you guys are out in the street. So that's how it started off. It was my way to pay back to law enforcement. And then as I became more involved, I saw the rush as well. And I saw the satisfaction of it. And that's why I eventually became a sworn law enforcement officer.
I was going to say, you're involved in law enforcement yourself,
yeah.
Aside from being a trauma surgeon.
Yeah.
Because one wasn't enough adrenaline for you, so you had to go for some more, right?
Yeah, it's a strange phenomena of seeing a gunshot wound victim and then 3 days later arresting the perp. I don't think that happens much with most people in this country.
No, that's a whole different.
Yeah.
That's you're covering the gambit because as police, we go out there and we're at the scene, we're doing the things, but then the detectives come in there.
Yeah.
So if you're working, they got some of those one-horse towns where a guy will do everything soup to nuts.
Yeah,
that usually doesn't happen in law enforcement, nor does it happen in your field. But your capacity as a law enforcement officer, is it because of your medicine background? I'm trying to find out what your connection is, or is that just something you just wanted to do?
I think it was a parallel road that has some interconnections, and I chose to cross back and forth from each of them.
And what's that done as far as, has it made you a better doctor to work in that field?
Yeah, I think a couple of things have made me a better doctor. I think working with people who are selfless is a big deal for me. And I think anybody in law enforcement is selfless.
That's what I was going to say.
Anybody who served our country is selfless.
Any good cop is selfless.
Yeah.
Well, there's 3 reasons why you do anything: mission, message, and money.
Right.
And if you're doing it for the money, I'm sorry to say it's for the wrong reasons.
Yeah.
But that mission and that message, I mean, that's why we do a show, because we have those things. But I'm sure you've had some wins and you've had some losses. You've probably seen some of the worst trauma that you could possibly imagine. What if you could pick out one? I know there's always one that stands out.
Yeah.
What would it be?
So I won't get too graphic with some of the things, but one of the stories that sticks in my mind was when I was in the South Bronx, and they brought in this couple of month old baby that was backboard and collared, not crying, just sitting there staring at the ceiling, and its head was 3-4 times the diameter it should have been. And ultimately learned that his dad has grabbed him by the legs and was banging him against the wall so hard that his skull fractured and he had big bleed in his brain. But he knew that if he cried, he would get beat up more.
Get hit again, yeah. That's sad.
So he was sitting there in a backboard and collar. Nurses are crying, looking at this little kid. Just horrible, horrible night. And we take x-rays of the kid, and he's had healed fractures, and he's only a couple of months old. So this has been going on from the minute he was born, but he knew not to cry. And the most beautiful part of that night was the trauma on that night. We got his dad as the next trauma after that. Some justice was done there.
Gunshot wound?
Some justice was done. NYPD did a good thing that night.
Yeah, getting hit with a phone book wasn't always a bad thing.
Yeah.
I mean, because they know the courts are. So here's the sad part about that.
Yeah.
If he goes to say he gets locked up for child abuse, but then he shows good faith and goes through programs, he'll get that kid back when he should have never been a father in the beginning.
Yeah, exactly.
Right.
You know, there's people in this world who try and they'd be great parents. I have many friends who can't have kids, and they'd be wonderful parents.
Right.
And then there's some people who don't even try. They have kids. They don't even want them, and they do things like that to them. That's the sad part of this world.
Yeah.
And
there's certainly evil out there.
now,
See it.
And that was one of the tough things in law enforcement too. You had to, if there was any kind of child abuse, you had to treat the abuser like a treat them like a real person in order to get them to talk and fess up. And you're sitting across the table, you just want to reach across and grab them by the throat.
when you're transporting them, though, that's what they make waffle jobs for.
Yeah, exactly.
But you know what? That really bothers me as like a doctor as well. So as a law enforcement officer, I arrest pedophiles. There's quite a bit in our task force.
I don't know how you control yourself around that.
But the thing that kills me as a doctor is that's normal to them. Just like we love women and we are attracted to women, and it's completely. Yeah, I heard some things.
Yeah, I mean, yeah, they'll tell you.
So we love a certain gender. Let's be politically correct. We love a certain gender, and that's perfectly normal in their mind. That's perfectly normal. That's what they crave. That's what it feels normal to them. That's what satisfies them, and that's the disturbing part.
So we were talking about waffle jobs. I don't know if you know what a waffle job is.
I'm not familiar.
Okay, so there used to be cages in the cars.
Oh, yeah.
And if somebody's being combative, you don't have time you're not going to reach in there and seatbelt them. So you just hit the gas and then stop and boom. And you shut them up real
waffle
quick.
face, right?
This was the days before cameras in cars and stuff like that. It was a good time.
Yeah.
You know, the little street
couldn't
justice.
stop the car. You can't hit a guy that's in handcuffs, right? So you couldn't get out and do anything like that. So you give him a waffle job.
Yeah.
No, but you could make his thumbs touch the back of his head in handcuffs, and that. You can have a camera right on. But it's street justice. You try not to be the judge, jury, and executioner all in one. But there are certain times where you're biting your lip. You're like, you son of a bitch. Like, what did you do? And we're helpless at that point. We got no power. Just like if that person who did that to that kid, the trauma kid, you have to treat them like you have the Hippocratic Oath. You have to. And
you had to give that day. You had to give the same care to that kid as his father who came in.
That's nuts, isn't it?
Yeah.
You can't just sit back and say, I think we'll make it.
Yeah.
Again, take 2 of these and I'll see you in the morning.
Exactly.
But then you had some wins too.
Lots of wins.
You have lots of wins. I mean, you've been doing this. I've read your resume, and you've been doing this for so long, and you've done such great things. People don't rise to your level without doing some incredibly great things. Where obviously, I don't even want to hear any more stories like that little kid. But tell us about your greatest win. No, first of all, that child, did he make it?
Yeah, he actually did okay.
All right, and hopefully he got into a better household after that.
Yeah.
Did the father make it?
Unfortunately, yes. So when, so I'll tell you a situation where I was in the hospital and I heard a code being called overhead, and it was like a certain color that you don't normally hear. Like, code red is like a CPR. And so I heard a certain code and I didn't know what it was. And I'm just sitting up there and I didn't have to respond to it. And then I heard it again a second time. So let's just go down the ER and see what it is. And I turned the corner and there's a pregnant lady that they're doing CPR on. And I was like, she looked very pregnant. And I was like, why didn't you guys deliver the baby? And they're like, oh, 2 doctors, OBGYN doctors came, put an ultrasound on the fetus, and there was no heartbeat, and they walked away and left because there was no fetal heartbeat, and the mom was undergoing CPR. So they couldn't get an airway on her, so I criked her. I did a trach at the bedside. I grabbed a scalpel, and I cut up the mom. I literally, in the ER, just with the scalpel, cut open, delivered the baby, and the baby was blue, did a couple of chest compressions, and the baby woke up. Meanwhile, everybody had already left and said the baby's dead and dismissed it. 2 attendings. I was a resident at the time. So basically, I didn't know that they had already been there at the time and said that she was dead, that the baby was dead. I would have been fired had I done that today or anything else, because that's basically, assault on a dead body. But that baby ended up surviving, and the dad was very thankful. But people had walked away from that woman and that baby saying that they were dead just because there was no fetal heart rate. And you know that fetuses can withstand a lack of oxygen very well because they have a different type of hemoglobin. That's why kids, when they fall in a lake, can survive for extended period of time without oxygen. And that's why I did it.
That's a great, it's a tragedy, but out of tragedy, there's beauty that comes out of ashes every once in a while.
Right.
But that seems to be, I'm sure that's not the only one, but that right there gives people hope that just one more compression, just one more push, just one more shot. You never give up.
So hope is one of my biggest things as a trauma surgeon. So are you guys familiar with the hope experiment, the rat experiment?
No. Oh, with the water? Yes, yeah. I do know this. So this is an amazing study.
So in the 1950s, you couldn't do the study today. The animal activists wouldn't allow this study. So in the 1950s, a doctor named Kurt Richter, a Harvard doctor,
so when this is the one where he would take them out. Water, he would take them out occasionally,
and he put rats in this jar of water to see how long they could tread water. And after 15 minutes, almost all the rats would drown. So that was his benchmark, 15 minutes. So the real part of the experiment was right before 15 minutes after that, he would pluck them out. These were domesticated rats. He would pluck them out of the water, dry them off, give them a little rest, and then throw them back in the water. So the question is, how long did the rats survive on the second attempt? Did they survive the same 15 minutes? Did they survive 10 minutes? Did they survive 5 minutes? How long do you think? Take a guess.
It was 2 hours.
You'd say 2 hours.
I would probably say about 45 minutes.
45 minutes.
Yeah.
Guess what the answer is?
Maybe 24.
60 hours.
Wow.
That's the power of hope.
Well,
right?
That goes back to what we were saying in the beginning with the social media question. It's the loss of hope.
Yeah. Hope is an incredible thing to have in life. So basically the message is that we all have to have a reason to keep on swimming, right?
Yeah, without doubt.
Right? Human beings have to have that hope. And it's like a primitive instinct that we have as humans, that if we have that sliver of hope, whatever that minute chance is, we're going to keep on fighting.
So somebody told me hope stands for hold on, pain ends.
Hold on, pain ends.
And that's what it is. It's just, I saw a picture the other day of a guy digging for diamonds. Like these two guys, one on top of each other, they're digging for diamonds. One guy is within a sliver of hitting the big diamond cache, and he's walking away. Where the other guy just keeps going, and that's the guy that finds the diamonds. And it's just one more time. But that one more time has driven a lot of people insane. That one more time has killed a lot of people because they don't want to give up. But I would venture to say that there are times. Has there ever been a time where you've felt like, I can't do this?
Where you lost hope?
I've had a lot of personal things happen in my life, tragedies. I've had a lot of political, hospital-related politics things, people stabbing me in the back. Everyone goes through it in their life. But I've never had the point where I didn't want to be a doctor. I didn't want to be a surgeon. I didn't want to do what I do every day. It's the other shit that really messes things up. The politics, the insurance companies, all that.
So it's the clowns, not the circus.
Yeah, exactly.
You when you finally retired, hopefully you never do, because it sounds like you're doing a fantastic
I still have
job.
some juice in me.
Yeah. When you shuffle off, you're going to miss the clowns, not the circus, because that's what we say about police work. I don't miss the craziness of the administrative bullshit.
You miss the guys.
I miss the guys.
Without doubt.
Yeah. Some of them. Not all of them. Some of them. Some of the guys I wouldn't give 2 cents for.
Yeah.
But that's just
there's always those.
That's just my jaded.
I saw a couple of them the other day, and they're like, hey, you used to work with them. Why don't you go over and say hi? I said, no, that's all right. They see me too. They want to come over and say hi to me. They can come over to me.
So you've reached some political heights too. You've been director of some. I mean, I know you do stuff. You do some. I don't know how you get those positions. It has to. Is it on performance based, or is it just your knowledge or your personality?
It's not who you know in medicine generally. It's in some positions, but generally when you arrive to, like, I was a chief of trauma at NYU, and then I was a chief of trauma at Columbia University, and I was the surgeon for the United States Secret Service. I've held some pretty good positions in my lifetime and done some amazing things that we could never even talk about. But I think they're based on merit. I don't think it's based on who you know in medicine.
But how do you get to that level? Is it just they look at your resume? Oh, you have 50 saves. You're our guy.
I think you get a reputation. It's a small community of trauma surgeons, and the community is small. Just like, you can tell working with a cop for 2 seconds if they know what they're doing, right?
Yeah, exactly.
True. Very, very, very true.
It takes 2 minutes to figure that out.
Yeah, but so, like, you're always evolving and everything. And one of the things I actually wanted to talk to you about, so they're doing some amazing things with robotic surgeries and stuff. But again, it takes that humanity out. A robot might go in there with that woman who coded, and you delivered the baby and got the baby back. That robot may have quit because it read all the metrics that says that this.
So let me put the myth about robotic surgery, because I'm a robotic surgeon myself. So about 4 or 5 years ago, trauma has become very non-operative. We learned how to control bleeding and other things without cutting people open and doing surgery. So I was kind of getting, not bored, but a little frustrated that I wasn't operating as much. So 4 or 5 years ago, they trained me to be a robotic surgeon. And there's a lot of myths about robotic surgery, but basically I'm controlling it.
I was going to say, the surgeon controls the robot.
So I'm sitting in a 3D high definition area across from the patient using my arms and legs. So now I have 4 arms that are going into the patient, and I'm controlling every single movement. So when you hear robotic surgery, it's not true robotic surgery. It's just assisted.
You're not really hands-on.
Exactly. You're not
physically hands-on.
You're able to move your hands or the robot hand in certain directions that the human body would never be able to turn around. I could be suturing up, and I could flip my screen so that I'm suturing down. I can work in a hole that I would never be able to suture in with my hand. It's just really, really amazing.
That's cool.
Yeah. And now with artificial intelligence coming into medicine, it's a really exciting time.
I think it was, I was just watching something. I think it was William McKinley. When he got shot, he died 10 days afterwards. And the reason he died is because some of the bullet fragment was still in there, and it was in a spot where they couldn't get to. But it sounds like that robotic surgery could have done something.
The bullets are not the problem. Bullets tend not to get infected. It's the wounds. So basically, when you're shot, the heat from the bullet and the primer leaving the gun is not enough to sterilize it. And you've touched the bullet anyway. So then the bullet is going through your clothing, which is not clean, and dragging it through the wound. Then the bullet typically either comes out through an exit wound or it gets lodged in muscle or bone or something like that. Those almost never get infected. We can leave those bullets there for years and they're not a problem. It's this clothing and the other stuff that's caught in the wound, usually the entry site. But we really don't see many wound infections. We don't. So what probably happened in that case, it hit an organ or hit a piece of bowel, and then there was leakage of bacteria. But you never see gunshot wounds that get infected. You really don't. So from your experience, somebody comes in with a gunshot wound, and you can sort of look at it, and you can pre-qualify it like, okay, this is going to be all right. So you can't. That's not necessarily true. I've seen people shot running in the ankle, and the bullet goes right up their leg into their chest. So that's why when you come in, the first thing we do is take off all your clothes and lift up your armpits, look in your crotch, because those bullets travel in amazing directions depending on whatever resistance of the tissue that it's going through. You should have sat on the Warren Commission. You could explain the magic. Exactly. Well, so from your experience, I don't know if you've ever looked at it. This is an interesting question. I'm a big fan of history, so I have to ask you this question. Oh, yeah. The magic bullet theory. Is that possible? So I think there were a couple of variables with the Kennedy assassination. One is that he was wearing that girdle that kept him erect, right? He had a lot of terrible back from issues. 109, yeah. And he had something, a buttress that basically kept him. So when the first time he was shot, he probably would have it just fell over, or if he had heard a gunshot wound, he probably could have even fallen over earlier. So that was one issue with it.
You know, out of all the things I've watched, nobody has ever brought that up.
They never bring up the girdle thing.
No.
Yeah.
Never.
And I knew he wore one.
Yeah. I think that was one of the major issues. I think he would have fallen down after the first shot.
I used to know somebody who was on PT 109, who was on it with John
Really?
Kennedy. Yeah.
Wow.
I mean, he was a really old man when I knew him, but
And, you know, now like that Secret Service agent who was on the assignment is coming out saying